When will life return to normal, and could there be a second wave of COVID-19? This morning we are joined by Dr. Hashibul Hannan from SignatureCare Emergency Center to discuss these concerns. Good morning, Doctor. Thank you for joining us, and we do appreciate your insight into this particular situation. But the question that a lot of people have right now, after having been inside their home for almost 2 weeks now, is when will it end? Is there an answer to that?
Thank you, Jose, for having me. This is an excellent question. I think everyone is asking this question. By now, everyone is tired of staying at home. That has one thing that has happened. And the second thing that has happened is a lot of people know someone that has passed away from this infection. So the short answer to the big question is that it is most certainly going to happen. The second wave for sure is going to happen, and for the simple reason is this: because we were so good at tackling the first wave, we have shielded most of our population from this infection. If you look at the data today, Houston reports only about 3,000 to 4,000 people infected. Let's say it's not accurate. Let's say more than 10 times of that is infected. So even at 30,000 people out of 2.3 million Houstonians are infected, that still leaves a huge portion of the population still vulnerable to this disease and vulnerable to the next wave. As far as the question of is there going to be a next wave, for sure there's going to be a second wave. However, I am comforted by the fact that our nation and we have taken some very positive measures. We're going in the right direction so that the second wave is going to be milder. We are going to be more prepared with more testing. We're going to be more prepared with treatment options, and we are going to be more prepared with more vigilance, and people will not be caught off guard, so that when the next wave does hit us, we are more prepared for that.
Doctor, a lot of testing was delayed, not just by the federal government, but because there were no supplies available for the test to take place. But now it seems as though experts are concerned that we are so far behind with the testing. Is that a concern that the medical community has right now?
Absolutely. I will tell you, though, I'm optimistic about testing. There are some good solutions that are in the pipeline. Even at our clinic, we are starting to test people more frequently. Before, it was taking us 5 to 10 days to get test results back. Now we can get the test done in 1 day. However, for us to be able to tackle this second wave, we need to get at least 100 times more the capability we have today. We need to make sure people can test this at their own home, like they do for pregnancy tests or home glucose monitors. Only at that level, when everyone can know for sure if they're infected or they have been infected in the past, if people know this information, if they're armed with this information, they can self-monitor themselves much better, and we can go back to being normal out there. When we know that everyone knows they're safe to mingle with other people, that's when people will let their guard down, and that's when society can go back to normal.
And everyone is hoping that that takes place very soon, but it looks like it won't be as soon as many expected. Dr. Hannan, thank you so very much for joining us this morning and expressing your expertise in this area.